When it comes to managing anxiety, finding the right medication can make all the difference. Two commonly prescribed anxiolytics, Buspar and Atarax, offer relief for those struggling with anxiety disorders. Understanding the similarities and differences between these medications is crucial in making an informed decision about which one may be best for you. Buspar, also known as Buspirone, is a popular choice for individuals seeking a non-addictive alternative to traditional benzodiazepines. It works by binding to certain receptors in the brain to alleviate anxiety symptoms. On the other hand, Atarax, or Hydroxyzine, is an antihistamine primarily used to treat allergies, but it also possesses anti-anxiety properties. It works by reducing histamine activity in the brain, resulting in a calming effect. While both medications can help manage anxiety, they differ in terms of efficacy, side effects, and potential interactions with other medications. Understanding these nuances is essential to finding the right medication for your specific needs. In this video, we will explore the key differences between Buspar and Atarax, helping you make an informed decision about which anxiolytic may be most suitable for you. From efficacy to side effects, we will provide a comprehensive comparison to aid in your anxiety management journey. Understanding anxiety and the need for anxiolytics. Anxiety is a common mental health condition that affects millions of people worldwide. It is characterized by excessive worry, fear, and a sense of impending doom. While mild anxiety is a normal response to stress, severe and persistent anxiety can significantly impact a person's quality of life. For individuals with anxiety disorders, medication can be an important part of their treatment plan. Anxiolytics, or anti-anxiety medications, are prescribed to help alleviate the symptoms of anxiety and improve overall well-being. These medications work by targeting neurotransmitters in the brain that regulate mood and anxiety. What is Buspar? Buspar, or Buspirone, is an anxiolytic medication that belongs to the class of drugs known as azapirones. It is commonly prescribed for the treatment of generalized anxiety disorder, GAD, and is often favored as a non-addictive alternative to benzodiazepines. Buspar works by binding to serotonin and dopamine receptors in the brain, which helps regulate mood and reduce anxiety. Unlike benzodiazepines, Buspar does not cause sedation or addiction, making it a safer option for long-term use. It is typically taken orally and can be used on an as-needed basis or as part of a daily regimen. The onset of action for Buspar is usually slower compared to benzodiazepines, taking several weeks for the full effects to be felt. This makes it less suitable for acute anxiety episodes but more suitable for long-term anxiety management. What is Atarax? Atarax, or Hydroxyzine, is primarily an antihistamine medication used to treat allergic reactions and itching. However, it also possesses anti-anxiety properties, making it a potentially suitable option for individuals with anxiety disorders. Unlike Buspar, Atarax is a sedating medication that can cause drowsiness. It works by blocking the effects of histamine, a chemical released by the body in response to allergens. By reducing histamine activity in the brain, Atarax produces a calming effect that can help alleviate anxiety symptoms. Atarax is available in oral tablet, oral syrup, and injectable forms. It is typically taken as needed for anxiety relief, although some individuals may use it on a regular basis for chronic anxiety management. As with any sedative medication, caution should be exercised when operating machinery or engaging in activities that require alertness. Mechanism of action: how Buspar and Atarax work. Buspar and Atarax work through different mechanisms to alleviate anxiety symptoms. Understanding their respective mechanisms of action can provide insight into how these medications affect the brain and help manage anxiety. Buspar acts by binding to serotonin receptors, specifically the 5-HT1A receptors, and dopamine receptors in the brain. By stimulating these receptors, Buspar increases the release of serotonin and dopamine, neurotransmitters that play a key role in regulating mood. This increase in neurotransmitter activity helps reduce anxiety and promote a sense of calm. Atarax, on the other hand, works by blocking the effects of histamine in the brain. Histamine is a chemical involved in the body's immune response and is also linked to anxiety and stress. By reducing histamine activity, Atarax produces a sedative effect that helps alleviate anxiety symptoms. While both medications target different neurotransmitters, they ultimately aim to achieve the same goal of reducing anxiety. However, the differences in their mechanisms of action can result in variations in efficacy and side effects. Efficacy and effectiveness: a comparison of Buspar and Atarax. When it comes to evaluating the efficacy of anxiolytic medications, it is essential to consider factors such as effectiveness, onset of action, and duration of effects. Comparing the efficacy of Buspar and Atarax can help individuals make an informed decision about which medication may be more suitable for their anxiety management needs. Numerous clinical studies have evaluated the effectiveness of Buspar in treating generalized anxiety disorder, GAD. Overall, these studies have shown that Buspar is effective in reducing anxiety symptoms and improving overall well-being in individuals with GAD. However, it is important to note that the onset of action for Buspar is generally slower compared to benzodiazepines, taking several weeks for the full effects to be felt. Atarax, on the other hand, has been less extensively studied for its effectiveness in treating anxiety disorders. While it is not a first-line treatment for anxiety, some individuals may find it helpful in managing their symptoms. However, the sedating effects of Atarax may limit its use in certain situations, such as during daytime activities that require alertness. Side effects and safety profile. Buspar versus Atarax. Like any medication, Buspar and Atarax can cause side effects. Understanding the potential side effects and safety profile of these medications is crucial in determining their suitability for anxiety management. Common side effects associated with Buspar include dizziness, nausea, headache, and lightheadedness. These side effects are generally mild and tend to improve over time as the body adjusts to the medication. Buspar is generally considered safe for long-term use and does not carry the risk of addiction associated with benzodiazepines. Atarax, being a sedating medication, can cause drowsiness and impair cognitive and motor function. This side effect makes Atarax less suitable for individuals who need to remain alert during the day. Other common side effects of Atarax include dry mouth, blurred vision, and constipation. It is important to note that Atarax should be used with caution in elderly individuals and those with liver or kidney impairment. In terms of safety, both Buspar and Atarax are generally considered safe for use when taken as prescribed. However, it is important to discuss any pre-existing medical conditions or medications you are taking with your healthcare provider to ensure the safety and efficacy of these medications for your specific situation. Choosing between Buspar and Atarax. Factors to consider. When deciding between Buspar and Atarax, several factors should be taken into consideration. These factors include the severity of your anxiety symptoms, the presence of other medical conditions, potential drug interactions, and personal preferences. If you have mild to moderate anxiety symptoms and prefer a non-sedating medication, Buspar may be a suitable option. Its non-addictive nature and favorable safety profile make it an attractive choice for long-term anxiety management. However, if you require immediate relief from acute anxiety episodes or struggle with allergies in addition to anxiety, Atarax may be more appropriate. It is important to consult with a healthcare professional who can evaluate your specific needs and provide personalized recommendations. They will consider your medical history, current medications, and individual preferences to help you make an informed decision about which medication is right for you. Alternative anxiolytics. Exploring other options. While Buspar and Atarax are commonly prescribed anxiolytics, there are other medications available for the management of anxiety. Some individuals may find that these alternatives better suit their needs or offer additional benefits. Benzodiazepines, such as Xanax and Valium, are commonly prescribed for the treatment of anxiety disorders. They provide rapid relief from anxiety symptoms but carry a higher risk of addiction and sedation compared to Buspar and Atarax. Benzodiazepines are typically used on a short-term basis or as needed for acute anxiety episodes. Selective serotonin reuptake inhibitors, SSRIs, such as Prozac and Zoloft, are another class of medications commonly used for anxiety management. They work by increasing the availability of serotonin in the brain, thereby improving mood and reducing anxiety. SSRIs are generally well tolerated and are often prescribed for long-term anxiety management. Other alternatives include serotonin norepinephrine reuptake inhibitors, SNRIs, such as Effexor and Cymbalta, and tricyclic antidepressants, TCAs, such as Elavil and Tofranol. These medications work by targeting different neurotransmitters involved in mood regulation and can be effective in managing anxiety symptoms. Buspar versus Atarax. Patient experiences and user reviews. While clinical studies provide valuable insights into the efficacy and safety of medications, patient experiences and user reviews can offer a different perspective. Hearing from individuals who have first-hand experience with Buspar or Atarax can provide valuable insights into the practical aspects of using these medications for anxiety management. User reviews for Buspar are generally positive, with many individuals reporting a reduction in anxiety symptoms and improved overall well-being. Some users appreciate the non-addictive nature of Buspar and find it to be a more sustainable long-term option compared to benzodiazepines. However, others report limited effectiveness or the need for higher doses to achieve the desired results. User experiences with Atarax vary, with some individuals finding it helpful in managing their anxiety symptoms, particularly in combination with other medications. However, due to its sedating effects, some users find it difficult to function during the day or experience excessive drowsiness. It is important to note that individual experiences may differ, and what works for one person may not work for another. Conclusion: making an informed decision for anxiety management. Choosing the right anxiolytic medication is an important decision in the management of anxiety. Buspar and Atarax offer different approaches to anxiety relief, with their own unique set of benefits and considerations. Buspar, known for its non-addictive nature and favorable safety profile, may be a suitable option for individuals seeking a long-term anxiety management solution. On the other hand, Atarax, with its sedating effects, may be more appropriate for individuals who require immediate relief from acute anxiety episodes or struggle with allergies alongside anxiety. It is crucial to consult with a healthcare professional who can assess your individual needs, medical history, and preferences to help you make an informed decision. They will consider factors such as the severity of your anxiety symptoms, potential drug interactions, and personal preferences to guide you towards the most suitable anxiolytic medication. Remember, everyone's experience with medication is unique, and what works for one person may not work for another. Finding the right anxiolytic may require some trial and error, but with proper guidance and support, you can find a medication that helps manage your anxiety and improves your overall well-being.